Hey, Kathy, have you ever Googled your symptoms?
Of course. Last week I had a headache, and Google said I was either dehydrated or possessed by a Victorian ghost.
That's actually a pretty narrow differential diagnosis.
And then I searched, why does my knee hurt when I squat? And somehow I ended up on a forum where a guy was recommending elk cartilage and moonlight stretching.
All right. Well, that is the beauty of the internet. You can start with back pain and end up buying supplements from a guy named Steve.
Oh, Steve. So we're answering the 10 most Googled questions about musculoskeletal pain before Steve gets to them.
Yes, this is the pitch.
What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch.
Oh, no. Everybody hold on. The Pitch Podcast is back. I'm Dr. Jason Young.
And I'm Dr. Kathy Lynch.
Okay, and we're the Pitch Podcast. Yeah, we got Raul over in the booth. Yes, so hi, Raul. And, can we send another shout out to somebody who is not in the studio, but we're in their room, like, often.
We are with her.
Yes.
At all times.
Yes. Enchanted Beauty. Our good friend Karen.
She's listening.
She's listening, and, she's probably doing somebody's eyebrows right now.
Absolutely.
Maybe a good bikini wax. And, hopefully I'm not messing things up by
Hold steady, Karen. Hold steady. No laughing.
But how cool is it? A aesthetic salon that is listening to the Pitch Podcast.
Absolutely.
Yes. Making people more beautiful and just a little bit smarter.
Just a touch smarter. Or, depending on the episode,
could possibly be dumber. Yes, could be dumber. I don't know, though. This episode could go either way.
It could go either.
Yes. Kathy, what are we talking about today?
Well, we were brainstorming ideas for the podcast, and I thought, well, what did people want to know?
Yeah.
Let's give the people what they want.
Give the people what they want.
Yes, show me the money.
Yes, we are a podcast of the people, for the people, by a couple of people.
So we thought, hey, let's try to answer in one episode the top 10 most Googled questions about musculoskeletal.
Are we doing all 10?
We're going to try.
We're going to have to steamroll this.
We will. I promise.
Okay.
We're going to try to get this done in an hour.
Man, we might need like a flag or something in case the rants start getting too ranty. It's like, shut up.
We're guaranteed to go on tangents.
Definitely going on tangents.
We'll try to see if we can.
What? On this podcast? So,
all right.
What you got?
Let's start off.
Numero uno.
Number one. Maybe you can answer this one. Number one most Googled question about musculoskeletal pain is, why does my back hurt?
Oh, that's easy. Probably because of sin. Yeah, you've offended God, and so now your back hurts and you deserve it.
I thought it was blue Gatorade.
Next question. No, that's a really great question, though. I've heard lots of crazy reasons why people think that their back hurts.
Yes.
But back pain, and by this, I'm guessing they mean lower back pain.
Yeah.
The most common type of back pain out there. But there is a statistic out there that 85% of people, and by people, of course, they mean Americans.
That's right.
85% of people will have at least one significant episode of lower back pain during their lifetime.
Oh, that's 85%?
85%.
I would say I would call up to about 100%.
Yeah, right. Well, and it's weird because it's like that makes sense to most people, but every once in a while you'll find somebody who's never experienced it. Kind of like you'll find somebody who's never had a headache, which I still think that those people, their condition is called lying, right? Everybody's had a headache, right? If not, just come hang out with me for a while. You'll get one.
The Google tells us that back pain is the leading cause of disability worldwide.
Worldwide, yes.
I believe that.
There are more days of work loss to lower back pain than any other condition, which is amazing. So not surprised at all that it is the number one most Googled question. People are out there looking for answers. The reason your back hurts is because you're not getting adjusted on a regular basis. That's what the research said. Not really.
I think we've had one whole episode on this. We talked about back pain a lot, but I think the thing that's scary about back pain is there are a lot of nerves back there. I mean, your spinal cord is back there.
It's where it lives.
Yeah, and so there's a lot of fear when you get back pain.
Totally.
Like, my back went out last night to the club.
Yeah, no, exactly. Did it come back by morning? Yeah. Yeah, and the good news is that most types of back pain are fairly benign. Most types of back pain will resolve on its own, which, some people are like, that's blasphemy. And all those people saying that are other chiropractors.
Yeah, that's right.
But it's true. Most people's episodes of back pain are transient. They will get better on their own. There are some that are definitely worth treating. And there's fortunately a lot of treatment options. Unfortunately for most people, they all work about the same. So
right.
it's a tricky area to research, but it's one that there is some pretty intense questions because back pain can be debilitating.
Yes, no doubt.
And I think that there's a lot of what goes along with it is psychological. And like, because you worry about, oh no, my back's gone out to the club with your back. And so what do you do about that? But I think some of the leading causes that I see of back pain are, people like to say postural stress, but postural stress can also be called inactivity.
Yes.
So a sedentary lifestyle, not moving, not taking care of the postural muscles, the endurance muscles there. That's a major cause. And then you have your more garden variety causes like strain. So lifting something heavy, lifting something that you're not prepared to lift, those kinds of things. And some of it's genetic, right? There's some people that have a genetic propensity towards some back pain, but I think that gets overblown too. And people are like, my uncle had a slipped disc. I hate that term. So I'm going to also, no.
Not hereditary.
Not hereditary.
Debunked
Thoroughly. But I think one thing that's interesting though is it's also cultural, which is something we don't really understand well because Americans get more lower back pain than other cultures. And there are cultures where they have virtually no lower back pain and like they're lifting heavy things and sleeping in huts or I don't know.
Yeah.
But
they're
weird.
not sitting as much.
I guess. But yeah, we Americans, we love our back pain.
We do.
And the Constitution and the flag.
We sure do. What is the second most Googled question?
Well, that's a great question. I'm going to look on your computer because for some reason I don't have that pulled up. Oh, yes. This is a great one. And people are asking, not only Google this, but they're asking their providers this. Don't I need an MRI? Or like, how would I know if I need an MRI?
Let's answer that one together. Ready?
1, 2, 3. Yes. No. Definitely no. Usually no. Hey, do you get this question, Kathy? People come in like, why don't they just do full body MRIs for everybody?
Yes.
Yeah. Yeah. And I think intellectually seems like a good idea, but from a practical standpoint, why, let's pretend MRIs are free.
Yes.
Why wouldn't everybody want an MRI?
The things we see on an MRI, what the picture doesn't correlate a lot of times with the pain.
Yeah.
The picture is one moment in time, and it's usually, unless you get a functional MRI, it's not when you're moving, it's you are laying down in one position. So it is not always going to give you the answer that you want. And then it's also going to give you things you don't want to see. And you cannot unsee it. And then you walk around thinking you got disc bulges all over your spine and you should never leave your bed.
Yeah.
Yeah.
Yeah. I've had a series of old men. I think that's how I describe them coming into the clinic lately. And it's a really interesting thing. About half of them that I've had come in, their doctors have jumped to early on, let's do some x-rays.
Mm-hmm.
And then the other half have not had that. Guess which half got better quickly?
The ones that didn't get the X-ray.
Ones that didn't have the x-rays, because the ones that did, they saw the arthritis, or actually arthrosis is what I should say, because you can't see the inflammation on the x-ray. But those guys, they saw those results and they decided, well, I'm done golfing. I can't go for a run anymore. And they disabled themselves by seeing too much of what was there. The guys who couldn't see that, they want to get back to golf. They want to get back to all these things that, and guess who gets the results? It's not the dudes who decide that Sudoku is their new sport.
No, that is the truth.
Yeah.
And we know from research that imaging doesn't necessarily mean we're going to get better outcomes either. And I think I heard this, from you several times, but I think you've said, oh gosh, now I can't think about it. The only reason, what is it you always say about surgery?
I only say two or three things.
Surgery about MRI.
Well, yeah. Well, I have said that the main reason. Now I can't think of
out of my brain.
No, it's like it's the leading cause of surgery is an MRI. Yeah.
How could I come up with that?
Yeah.
Oh God, my brain just went on a.
Okay.
Okay, and we're back.
So takeaways for this episode. I don't know if we can get the other 8. We're struggling at 2.
Wow.
Okay. Yeah, but yeah, it's the leading cause of surgery is an MRI.
MRI is the leading cause.
And there's a piece of me that when I'm working with patients, I almost want to reserve the MRI for when I'm referring somebody to a neurosurgeon. Yes. Because when we've done all the conservative stuff that we can, and it's time for you to take it to the next level, they're who needs that MRI information. Do you need MRI information?
Not really.
Yeah, I don't really either. Right? It's not too tough to figure out through an orthopedic test what is probably going on with somebody. Right. So I don't need an MRI. People who need the MRI are the people who are going to cut you open and save the day.
Yes. Well, if conservative treatment hasn't worked, that's when I'm like, you know what, it might be time for imaging. So they obviously serve a great purpose. Right. But early on in pain and early on in an injury, unless, it's a knee or ankle, but you generally don't need an MRI. Right.
In fact, I'm looking this up because I'm trying to think of the study where I saw this, and I don't think that that's my saying. I think that it's something that is confirmed.
It's literally the leading cause of
yes, here it is. Early MRI for low back pain is associated with substantially higher odds of spinal surgery. Yeah. In an elderly Medicare Advantage population, early imaging was associated with an adjusted odds ratio of 3.4 for spinal surgery compared to those with early imaging. So you are many times more likely to have surgery if you have an early MRI.
Early MRI, okay.
An early MRI.
Okay.
So, yeah.
Don't do it.
Do I need an MRI? I think you could swap want for need. Do you want an MRI?
Right.
Do you want surgery?
Correct.
And it's not to say that surgery is not necessary ever.
Yes.
But you are probably, according to the studies, you're probably more likely to get an unnecessary or an avoidable surgery if you have an early MRI.
Let's avoid those surgeries if we can.
Yeah. I mean, I think it sounds good.
All right.
But just really quickly,
yes.
and we'll get on to number 3. You have people that come in and they're like, I don't know what's wrong with this. I just want to get whatever surgery it is.
Yes.
And that's weird. It's so weird to me. There's some people that come in, they're like, just do the surgery and let's fix it.
Yeah.
Yeah.
I mean, no. Yeah. And I had a patient recently. It's like, well, my doctor said that we got to jump through hoops. So that's why I'm here at physical therapy so that I can get the MRI.
Yeah.
And finally I get my MRI scheduled next week.
Yeah. We just gotta check this PT box so I can get my surgery.
I take a deep breath and a swig of whiskey.
If you ever go to Encore Physical Therapy, PT's so good, you're gonna want more. Check out Dr. Kathy Lynch's hip flask that she's carrying around with her. And if you see her reach for the hip flask, you probably just said something real stupid. Yeah. Oh, she's going for the flask. I'll retract that statement. I'm so sorry. I'll do my squats. Yeah. Yeah, just huh? All right.
Okay.
Question 3.
Question 3. Number 3 most Googled. We should have gone backwards. Anyway. Number 3 most Googled question: is my sciatica serious?
First,
I know that
the first. Yeah. The first question is it seriously sciatica?
Usually not.
Yeah. So this sciatica is a term that gets like kicked around all the time, like literally. Not like literally kicked around all the time, but kicked around like the word literally.
Yeah.
Which now people use for things that they are intentionally saying is not literal. Like literally every time you blah 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 blah. No, that is not how it's used, right? So sciatica gets overused a lot. And I've seen it used to mean everything from really, really, really bad lower back pain or mild lower back pain to full-blown sciatica where people have foot drop and numbness and tingling and
can't get away from the pain.
Searing pain down their leg. Yeah. But it's only one of those things. It's not the first thing.
I'll just say this. If you're Googling it, it's probably not serious. Because if it's serious sciatica, you are going to urgent care or the ER. The pain is that bad.
Yeah. So just so people know, sciatica it happens in one place in your body, in one place only. And that's in your lumbar spine. Okay. And in order for you to have sciatica, you need at your lumbar spine where the nerves are exiting, you need some sort of compressive force, whether that is a disc pushing on that nerve root, or it could be that there's a mass in there, or that there is a bone pushing on there. And that is the order of the likelihood of those things: disc, mass, bone. Okay. And so it only happens up there in your back, and you will feel it radiating down past your knee, past your knee, not to your knee, not north of your knee, past your knee.
South.
Also, you're going to feel it in the back of your leg. So if you have these sensations in the front of your leg and the front of your thigh, that's not sciatica. It's probably a femoral nerve problem. The femoral nerve is not the same as your sciatic nerve.
It is not.
And it'll cause numbness, tingling, muscle weakness, or shooting pain down past your knee. Down past your knee.
Past.
Yes. And if you don't have that, you don't have sciatica. Also, sciatica is typically just going to be one side, not both.
Right.
So if you just have hip pain, that's not sciatica. Even if your medical doctor told you you've got sciatica, because there's some medical doctors who don't have a lot of background in musculoskeletal things, who they just think anything that refers to any part of the leg is sciatica. And the difference matters because the treatment is different for sciatic problems than for other types of problems. Like you could have an actual leg problem, right? And if we're just treating your back and not your leg, how's your leg going to get better?
Yeah.
Yeah. Acupuncture.
Absolutely.
No, I don't know.
Craniosacral therapy.
Yeah. Craniosacral therapy, right?
No doubt.
Perimenopause. I feel like we're just going through old episodes. Plastic surgery.
We are. Because the next most Googled question is, should I rest or keep moving?
Oh, you take this one.
We just did a whole episode on this one. Likely, just keep moving. Unless it's a broken bone, it's a heart attack, or you're having a stroke.
Yeah, or you're bleeding out.
Yes, don't just keep moving. I mean, if you keep moving to the ER.
Yeah, it's like Dory, right? Just keep swimming.
Yes.
I don't like swimming. Yeah.
Yeah, we did probably a month ago a whole episode on rest. When rest is good, when rest is when you need to do rest and when you shouldn't rest. Especially with back pain, do not just rest.
Yeah.
Gentle movement, short walks, getting up, stretching your legs, moving around every hour. Just keep moving.
Yeah, and appropriate loading.
Yeah,
right.
appropriate
so
loading.
I feel like we
yes.
keep hitting certain themes. So appropriate loading, blood flow to areas, movement, all those things. And so that's an easy one. I wish that we could just hard code it into Google that it always said, "Nah, keep going, keep moving." Yeah,
Likely just keep going. 95% confident you can keep moving a little bit.
totally, absolutely. So,
Okay.
all right.
Question number 5. Why does my neck hurt?
Okay.
So back was number 1.
Yes.
Neck, number 5.
Neck is number 5. All right. Well, let's talk about probably one of the most pervasive and controversial made-up conditions that circulate on social media. My people are guilty of spreading the word on this, and that is a condition called tech neck. Have you heard of this?
I've heard of tech neck.
Yeah. So, I mean, bless their hearts.
Yeah.
They mean well, the people who talk about tech neck, but tech neck is not really a thing. It's this idea that everybody in our culture has neck pain because we're looking down at our phones. Can you get neck pain from this? Sure. Does it change the curve in your neck? No. Is it the main driver of neck pain in our society? Also no. Like there's really no evidence to support that. And there's lots of research. So the same kind of things that would bother your neck would probably bother the rest of you. The tech neck thing is probably more associated with a lack of movement in general. I'll put it this way. It is more harmful to your neck and your entire spine that you're being sedentary than that you're looking down. Necks are made to look down really pretty well.
Do you think people, while searching Google, are looking down and texting, "Why does my neck hurt?"
Yeah. Ironically, yes. Well, and I've told people, I tell people this less, but early career, I would tell people, if you don't look like an idiot when you're using your phone, you're not doing it right. Yeah. So I tell them, you want to have it up here. But you know what? You cannot do that for too long either. And maybe that's the only reason my advice worked, was it's like, eventually you're just going to give up because this looks stupid and it feels even worse. So, I don't know how pockets work. I can't put my phone in my pocket now. And here's the other thing too, is when you look at the way that bodies are designed, the eye part of your head is built different than the non-eye part of your head.
You mean the front of your head?
Yes, okay. That's exactly what I'm talking about. And so because this is where our eyes are, we're also pretty well designed to do things that are in front of us, right?
Gotcha.
So what was the question again? Why does my neck hurt? Yeah. So some of the most common reasons I see that people's neck hurts, besides not moving enough, people's beds hurt their necks. Like if you got a weird pillow situation, like you got 6 or 7 pillows, and so you're sleeping like all curled up, and you wake up in the morning and your neck is all stiff.
Yeah.
It's a really common reason.
I have not found the perfect pillow yet. Do you have pillow recommendations?
I do. We're looking for sponsors.
Okay.
And so what I recommend is the My Pillow. It's a great politically. This is an important. Raul's over there dying. Woo! Yeah. Nobody should buy My Pillow. It's the worst pillow, and I'm not just talking politics. It's not a good pillow. My pillow speech goes like this. If you're a side sleeper, which people come in, they're like, I'm a side sleeper, so that's why I have lots of people sleep on your side. It's fine to sleep on your side. But you need a pillow that's going to fill the space in between your AC joint, which is that kind of knobby space over your shoulder, and the neck. Okay. And it's got to be firm enough so that overnight it's not compressing to where you're in a weird position. You also don't want something that's going to push you too far the other way.
Mm-hmm.
And you're going to have to change pillows from time to time.
Yeah, I think it's time.
Yeah, so sometimes the pillows change, sometimes your situation changes, your mattress is changing softness. So it's okay to have to change it up sometimes. I know some people who they do really well with a rolled up towel behind their neck. So your position matters, the condition of your mattress matters. But pillows are fun. Usually when people are getting hurt, it's because they have too many pillows, not because they have not enough. At least that's what I see.
Yeah, and they're all
no evidence to back it up.
Okay.
All right.
Okay, we're breezing through these.
Okay.
All right. Question number 6. Is arthritis causing my pain? I don't know.
Sounds like a personal problem.
So usually if arthritis is causing your pain, the things that we listen for in when we're taking history of the patient is it takes me 30 minutes in the morning to get warmed up. Once I'm moving around, I feel a lot better.
Yeah.
Or I've been sitting in my car and I get out of my car and my knee's really stiff. Usually that's one of the first clues where I think, this is probably arthritis. So,
yeah. But Kathy, what if they're bone on bone? Huh? What if their bones are on their bones?
Then there's definitely arthritis.
Well, and I think it's really important to differentiate between arthritis and arthrosis.
Yeah.
It bugs me to no end when people come in and they have their x-ray and they're like, oh, according to my x-ray, I've got arthritis. It's like, are you having any pain? No. Are you having any joint inflammation? No. But I've got arthritis. Okay, no, you don't. You have arthrosis. And I don't blame people for not knowing the difference. I do blame their doctor for using the wrong word.
Well, yeah, when I read the reports that come back, the radiologist report, they say arthritis.
Yeah. Yeah. And it's like, how are you seeing the inflammation on the x-ray? Right? You can see, so technically the changes that are made in the bones there's inflammation involved in that process. But unless there's an active inflammatory process, that person has arthrosis, which is just a change in the shape of the bone. And one of the things that we know and has been acknowledged more and more lately, especially in the literature, is that arthrosis is normal and it's natural. It's a badge of honor.
It is.
Right?
Like getting gray hair.
It is. It is gray hair of the spine. And it is poorly associated with symptoms, meaning that they've done studies where they've taken 100 people off the street, they stick them in an MRI machine, which we've just discussed is so unwise. But for the sake of science,
why not?
All those people are dead now. They're all dead. They had surgery and died. Oh, this is a good time for the disclaimer.
Yes.
Yeah, none of this is true.
No. This is for entertainment purposes only.
Yeah, we're not giving medical advice.
No.
Not today.
No.
Maybe next week.
Yes.
But no, so they take 100 healthy people, stick them in an MRI, and they find like bulging discs. They find collapsed vertebrae. They find arthrosis all over the place. And the only way that these people got into the study is they didn't have symptoms. And so you see these findings, but they don't have any symptoms, and they're out there just leading normal lives. And so what it tells us is that the presence of those things doesn't necessarily mean that you're going to have a problem or that your problem is related to them.
Right.
That being said, those things are associated with pain. So that's kind of a weird thing. It's like, I thought you just said that they weren't. So people who, if they would have taken 100 people with like back pain, they would have found probably even more people with those conditions. And so there's more of an association there, but it's not automatic that if you have these changes that you're going to be in pain. The other thing too is those people that they took with back pain and they scanned them, those people aren't always going to have back pain for the rest of their life. And so these things come and go. You can have a flare-up of arthritis, which if you have a flare-up of arthritis, it does cause pain. But if you have arthrosis, you're probably just going to be fine until you die, which we all do.
You're going to die with arthrosis, not from it.
There's only one way out of this life. Yeah. I beat arthrosis to the grave.
Let's
right?
do it.
It's like, I'm taking you with me, arthrosis. All right. What's next?
All right. Question number 7. What exercises help pain?
Ridiculous.
People constantly search for the best exercises for back pain.
Man, there it is, back pain again.
There it is.
Yeah.
Yeah.
Well, could we skip back pain for a second?
Yeah.
And you have a lot to say on this, so I'll just say one short little thing. One of the best treatments for pain after exercise is exercise.
Right?
That's all I got to say about
yes.
that. Yeah.
Just keep on going.
Mm-hmm.
Circulation.
Yes. If you are sore after a marathon, one of the best things you could do is go for a little run.
Yeah.
Not another marathon.
No.
But a little run.
A little recovery run.
Yeah.
Yeah.
So what do you think? What exercises help with pain?
Well, it's funny because people do come in and they've already researched, they've Googled, have been doing exercises, what they tell me. And the exercises that they come in are actually good exercises. However, they may have gotten their diagnosis wrong. So they're doing exercises for back pain, but their back pain wasn't caused by a certain thing that this exercise is going to help them with.
Right.
So, any exercise is great. However, if you're having pain when you bend over in your back, and then you're doing extension exercises, lumbar extension exercises, that's not going to help. If you're doing bridges,
surprise.
If you're doing bridges,
yeah,
that's the opposite of what you need.
Right.
So
specificity of those exercises can matter. So it's a good question for people to Google.
It is, but at the same time, they're just going to get generalized.
Yes. Yeah. So you got to be careful. Like, and we both had the patient who's come in and said, I tried doing the exercises on YouTube.
Yeah.
You know, the exercises on YouTube.
Bob and Brad.
Yeah. And what I tell people is exercise is good for back pain.
Yeah.
I do a lot of back pain. So exercise is good for back pain. But medicine is also good for back pain. So if you go out there and you're taking birth control.
Yeah, that's a really good point. That's exactly.
Yeah. Yes. Which is medicine.
It is medicine.
Birth control is not going to fix your back pain. No. I mean, unless like you're trying to beat like pregnancy related back pain, which I'm not too worried about. So yeah. So some specificity is good.
Yes.
Let me ask you this though. What would you say are maybe some of your best general exercises, like your high value ones that are maybe going to hit a bunch of targets, right? Outside of like, you know, you've kind of alluded to directional loading where it's like, oh, does it hurt with flexion or extension? Like what is an exercise that you would recommend to anybody if you didn't have any information about what's causing their pain?
If I don't know what joint or what.
Yeah. What's going to be like a high value exercise that way?
Well, I always go with the squat.
Okay, squat's good.
Yeah, the squat. I mean, it's
fix your headache.
Absolutely. Hey, maybe you have a headache because you've been sedentary and you need to get some blood flow into the brain.
Yeah.
You know, maybe your neck is stiff because you've been sitting around. You know, get some blood into those neck muscles.
I like it, and I think psychologically that's a good one too. Because if you can squat, first of all, feeling that power in your legs, it's like it's a confidence builder, right? For me, I would say walking.
Yeah.
Right. Yeah. There's I mean, sometimes if I don't know what to do, I just tell people, go take a walk. Yeah. Just walk until it feels better. Yeah.
Yeah, and calf raises. We've talked about how the calf muscle is the heart of the lower body because it helps pump the blood back up into the heart and through the rest of your body. So yeah, I love heel raises. So if you
I'll give you another one. Dancing. I think dancing is very good exercise.
Yes.
Psychologically, cardiovascularly, and one of the best things about dancing is it's not just a sagittal plane movement where your treadmills, your ellipticals, your rowing machines, they all happen in a hallway, in an alleyway where like you're doing everything forward and back. Dancing is, you know, if you're doing it right, you should be moving side to side, maybe twisting. There's some rotational elements. So I think that's an excellent exercise.
What about walking like an Egyptian?
Oh, hey-oh. Do you think, hear me out, what do you think the chances are that we get the Bengals to come on the Pitch podcast? Are they alive?
I think they are.
Okay.
Let's do it.
Would there be value in that, though?
100%.
Like, do they know anything about health? Well, I guess they're alive all these years later.
Yeah. Talk about clicks.
All right. I'm going to give you that homework assignment. If you could get a Bengal on this show.
Is that Belinda Carlisle?
I don't know.
Okay.
Yeah, I was so young then. Only one of us was really young then. Yeah, let's see. Okay, let's make a bet. If you could get one of the Bengals to come on the show, even for just like a quick cameo, it doesn't have to be a whole episode. If you can get one of the Bengals to come on, I will. Let's see. What do you want? What could I get you that would make that bet worthwhile?
What you could get me is Neil Ivey, the women's basketball coach at Notre Dame, to come on.
Okay. All right. Okay.
Let's shoot for the stars.
Okay. Neil Ivey. Okay.
Coming on.
You get one of the Bengals. I'll get Neil Ivey. All right. We're going to reach out. Neil, if you're listening, like usual, have your agent reach out. All right. We should get to number 8.
Okay. Number 8. How do I know if it's serious? Okay. I had to tell you, I'm going to tangent right now, but I just started getting on Threads. You know, social media Threads. I hadn't been on it before.
Mm-hmm.
And I don't know why it is different than Twitter. I don't know, but I found this not hilarious thread of people posting pictures of injuries / things going on with their body.
Rashes.
And yes.
Oh, no.
And asking people on Threads, should I go to the emergency room?
Oh,
and
gosh.
this girl posted a picture of a quote unquote rash. She's like, what is this rash? And immediately people are like, RN here, MD here.
Yeah.
Get to the This is cellulitis.
Yeah.
This is going to kill you.
Oh my gosh.
And one guy just posted hospital. He forgot to put the S, and so he meant to write hospital. Nothing else.
He was in such a hurry to get her there. He just didn't even use all the letters.
Hospital.
Get to the hospital. Get to the hospital now.
And of course she updated us.
Yeah.
She did go. And she was in the hospital for like 2 days because she was about to become septic.
Been there, done that.
Yeah. And
the was not fun.
No. Yeah. And the worst part is the narrative that this is what American healthcare is like.
Yeah.
Nobody wants to go to urgent care or emergency room because they're going to be there all day long.
Mm-hmm.
And so I'm going to ask all these random people out there for some medical advice instead.
Man, that's crazy. You know, next time you see one of those threads, tag me.
Okay.
Because me and Nano Banana, the AI image generator, we're going to have some fun.
Okay.
Guys.
Done.
Guys, do you think this is serious? It'll be like a second head growing out of my collarbone. Should I have this looked at?
Hospital.
Get to the hospital now, man. Before you got to start brushing that thing's teeth.
Oh, okay. Yeah. That is the question number 8.
Okay,
most Googled. How do I know if it's serious?
How do I know if it's serious? I guess the big question is what's serious? But here are the biggest things. First of all, if you have fever,
yes.
If you have nausea, dizziness, ringing in the ears, cognition problems, difficulty breathing,
slurring speech,
get to the hospital. Waste no time. Get to the hospital. All right. Like palpitations, those kinds of things, chest pain.
Yes.
Like, do not wait. I have a very good friend who, thank God, is alive today because he was driving to work. And he had like a 20-minute commute. Mm-hmm. And no, actually, it was about 30 minutes. He was driving like through Philomath and had to go to Monmouth or something like that. And just as he's driving past the hospital, he's like, man, my chest hurts. He's like, geez, this is really, really tough. And he just took himself to the hospital.
Good job, buddy.
Because he was having a heart attack.
Yeah, oh God.
Right? And so people think I'm having a heart attack. It's like, it's going to like really punch me in the chest. Mm-mm. No, it's like just, those are the important things. So those are the really, really serious things. Also, what's the impact that it's having on your life, your ability to do things? If you now can't walk or you can't sit or you can't speak or whatever.
Right. Control your bladder.
Yeah, get some help.
Go to hospital.
Just really quickly.
Yes.
There is this thing with chiropractic where people are like, oh, if you get your neck adjusted, you're gonna have a stroke.
Yep.
So happens very rarely, but it happens. And there are some kind of telltale signs that somebody is at higher risk. So they have hypermobility. Typically, it's a female. Typically, it's going to be like under 40. I mean, migraine headache history. And you will have like a thunderclap headache, which is like all of a sudden, boom, worst headache you've ever had, nausea, dizziness, neck pain, those kinds of things. Those are signs that you could be having an artery dissection. And so those are things that people go to the chiropractor with, or they'll go to, the ER with and things like that. If any of those, characteristics, the hypermobility, the female, the age thing, the types of headaches, if any of those things fit, go to the ER. If you want an adjustment, that's fine. Get that after you go to the ER. But I have that conversation with people the same way that, somebody would have a conversation about somebody who's at high risk for a heart attack, right? We should be able to recognize some of the signs of something really serious and get to the hospital. Yeah. We're going to have to make a t-shirt now.
I'm telling you.
Get to the hospital.
I'm going to find that thread again. I'll send it to you.
Yes. Who would buy a t-shirt that said get to the hospital? Pitch Podcast.
Oh, yeah. 100%.
HOPITAL. And remember, there's no S in hospital. I'm going to make it happen. It's coming to the Pitch Podcast.
Yes.
So if you go to pitchpodcast.shop/swag, that's where you can get get your Nard shirt, get your Get to the Hospital shirt. Outstanding. All right, what's next?
All right, number 9. Why does it keep coming back?
Is this about in-laws? I thought we were talking about musculoskeletal.
I know. What is it?
No, shout out to my in-laws. They're great.
Okay,
yeah,
so
I hope they
your
keep coming
in-laws,
back
yeah.
now. My in-laws
Okay.
are amazing. I hit the jackpot. Oh.
Okay, so
why does
the
back,
pain
Kathy?
keep coming back?
What's the answer to that?
Recurrence is common.
Yeah.
It does. I mean, if you're living life right,
You stayed alive long enough. That's why it came back.
That's true.
Uh-huh.
That's true.
Yeah.
If you're living life right, you're probably going to have some pain.
Yeah.
Yeah, and if you're living wrong, you're probably having a lot of pain too. So
Yeah.
you might as well have fun. Get out there.
Yeah. And sometimes it's just like a freak thing, right? Like you can stub your toe twice, right? And I think sometimes, though, it's because you haven't changed your habits. You haven't changed what you do. You're doing the same things over and over. And that can be one of the leading causes of recurring pain. It's not because you have a bad back or a bad knee or anything like that. A lot of times it's just because you haven't found the right habits and doing those long term. People are like, am I going to have to exercise? If you want to feel good and stay alive, yeah.
Forever.
Yeah.
Yes.
Or people are like, chiropractic adjustments are temporary. Yeah, everything's temporary. You know what else is temporary? Nutrition. You have to eat every day.
Every day.
Right. Hydration, temporary. You will die if you don't do it.
That's
right.
a really good point.
So it's like, it probably keeps coming back because you haven't identified the habits that are leading to it. Some of those habits might be like, I don't know, rugby or pickleball. No, I'm just kidding. Those are fine.
All right, last but not least.
We made it to number 10.
Did.
Here we go.
We sped through
sweet.
these.
And then I've got a good game for you.
Okay, excellent.
Okay.
Okay, top 10th most Googled question. Will I need surgery?
Probably.
Did you have an MRI?
Yeah, right. Get your MRI, get your surgery. Yeah.
Get it here.
Why is that even a question? That's not number 1. Yeah. I think here's what I would tell people about surgery. I would say, don't worry about surgery until it's time to worry about surgery.
Yeah.
You can always have surgery, right? And if you need an emergency surgery, guess what? You get to the hospital, you're going to get that emergency surgery. If you need, I need to stop or say the correct word again for the rest of my life. Ah, crap. You ruined me. Yeah.
Okay. Yeah.
I mean, don't you think?
I totally agree. I mean, you get You got to do 6 weeks of PT anyway.
It's one of
just
those
do
things
it.
you got to check off the list.
Check it off the
Right.
list. They'll teach you how to jump through hoops.
I wonder if there's people out there that ever come in and they're like, could you just write down that I did 6 weeks of PT so that I could go ahead and get my surgery?
I've had people I think they needed like 6 visits, so they wanted to get them all in 1 week, or I've had that happen for sure.
Yeah.
Like, oh, they said I need 6 visits.
Mhm.
So like,
This is like our default patient voice.
I know. I guess it's all the old men that come in and are like,
Yeah. Or, you know, when some lady comes in and she's talking like this, it's like, oh, I know who you are. I know who you are. Right. Yeah. Somebody's listening. They're like, oh, it's my Uncle Dan. He's the one with all the problems. Oh, my goodness. All right.
Okay.
Well, that's good. We made it through.
Yeah, we
All
did.
right. Cool.
That's the Cliff's Notes
So I
version.
just hope people feel like a fool if they ever Google any of those, right? I guess we should check again in maybe 6 months and see if the list has changed.
Yeah.
We'll see how much the Pitch podcast is moving
the needle. Yeah.
All right, Pitches. Do your thing, right? Okay, you want to play a game?
Yeah.
All right.
Let's
This
go.
is called the MSK Google game. Real or fake? So people type the strangest things into Google at 2 a.m. And in each round, you're going to be given 3 searches or conditions that people might look for. 2 are fake, 1 is real, a documented thing that people actually Google, right?
Okay.
Now, we've already revealed the answers on like maybe 1 or 2 of these, but I'm going to read all 3 conditions. And then you're going to lock in the one that you think is real, just one of them's real, before I reveal. And the rest of this does not rhyme.
Okay.
I just felt like I was on a roll. Okay. All right. So, round 1, thumb trouble, thumb problems caused by a condition called Venmo wrist, WhatsAppitis, or FaceTime finger. I'll repeat them. A, Venmo wrist, B, WhatsAppitis, or C, FaceTime finger.
WhatsAppitis.
That is correct.
Oh!
Yes. WhatsAppitis,
Yes.
a real repetitive strain injury named after the app first described in The Lancet.
Really?
Yes, the journal in
Lancet.
2014 after
Wow.
a doctor logged 6+ hours of messaging wrecked her thumbs. It's de Quervain's tenosynovitis wearing a hoodie. Okay.
What was she
All right.
doing for 6 hours?
I don't know. Right. Chart notes on WhatsApp.
On WhatsApp.
Weird. All right. Round 2. Bend the elbow.
Okay.
Not the knee. Which one of these is real? A, drone elbow. B, karaoke elbow. Or C, selfie elbow.
Oh, selfie elbow.
Final answer?
Final answer.
All right. You are correct. 2 for 2.
Okay.
Selfie elbow. It's real, and it's really just lateral epicondylitis. So it's tennis elbow. So it's caused by extending, locking your arm to the frame. The perfect selfie, same tendon, dumber cause. I think that right now, Kathy, we should see if we're going to get it.
Gonna get it?
Let's get a selfie. All right. That will be posted nowhere ever. Okay, round 3. Pain in the neck.
Okay.
Is it A, tech neck, B, binge watch neck, or C, sunroof neck?
Oh, sunroof neck.
Yeah, that sounds really painful. Yeah, you already know the answer.
Tech neck.
Yeah, it's tech neck. Tech neck, a.k.a. text neck. Real and heavily Googled. Real, okay.
Quote, unquote.
The further your head tilts forward over a screen, the more effective load it puts on your cervical spine and shoulders. And there is something to that. Like for every inch forward that your head is, it is
right.
more pounds of pressure. But yeah, it's no different though than reading a book or cooking dinner or whatever. Quilting, crocheting, needlepoint.
The original tech neck.
All right, round 4, the 2 a.m. search bar. Okay, these are phrased the way that people actually type them, okay? Can you sneeze a disc out of place? That's A. B, why does my spine sound like a glow stick? Or C, lower back pain and tingling in my butt. Should I worry?
That one. Definitely.
You are correct.
Hospital.
Yeah, so this is this is a genuinely documented real world search. And it isn't just funny because back pain plus saddle numbness and tingling around the groin and buttocks and any bowel or bladder changes is a red flag for
Cauda equina.
Cauda equina, which is a surgical emergency.
Very
skip the MRI.
serious.
So they tell us in chiropractic school, you will probably see around one case of Cauda equina syndrome on average per chiropractor. I saw mine when I was in chiropractic school.
Wow.
Yeah, the lady came in. I can no longer feel when I wipe. So we sent her up to OHSU. She had decompressive surgery that very day.
Yes, that it's that emergent.
Yes. So those things. Okay. Round 5, final round. Man, we should have had some exciting music for this part. This round's called The Hands Full. Is it A, trackpad wrist, B, text claw, or C, stylus knuckle?
Ooh, stylus knuckle.
Oh, okay.
No,
yes.
shucks.
The real one was
phone a friend. Raul? Phone a friend.
Raul, this is your chance to steal for all the points. Trackpad wrist, text claw, or stylus knuckle. If you say stylus knuckle, you're the biggest loser. Because she already said it and it was wrong.
So you got a 50-50 chance.
Text claw. That is correct.
Ah.
Yes. It's a real term for cramping, aching, and fatigue in the fingers, wrists, and forearm from gripping and scrolling a phone all day long.
People.
The take-home here is phones are great for business. Yes, it often travels upward towards cell phone elbow, which is ulnar nerve irritation in the cubital tunnel. You hold that arm bent. The cure for this, of course, though, is every once in a while, you give it the selfie elbow, right? If you go from text claw to selfie elbow, text claw to selfie elbow, that's good exercise, right? Do it while you're taking a walk. All right, Kathy, takeaways from
Takeaways. People are turning to the internet for medical advice.
What a disaster.
Should I go?
Well, the great irony is we're being experienced mostly on the internet for this show.
It is good.
Yes, this life-saving information. So
for entertainment purposes only.
Yeah. My takeaway is I'm really glad that we're doing this episode, that we did this episode, because we're pretty much done now. Yeah. I'm sure everybody's thrilled about that.
Yes.
But this is going to be a great one to share with patients. This is going to save me so much time. Like somebody's going to ask me a question. I'm going to be like, okay, listen, I'm just going to send you an email. Just hit play, put it on double speed. Yeah. Get to the hospital. Yeah. All right. So let's talk about our sponsors.
Okay.
I'll talk about my favorite chiropractic clinic in town.
Yeah. Tell me.
Body of Health Chiropractic and Wellness
wonderful.
Center. Yes, one of our gracious sponsors. I may also be the founder and owner of that establishment, but hey, I think it's pretty great. What about
I've
you,
heard
Kathy?
good things about it.
What's that on your shirt?
Oh. Yes, Encore Physical Therapy.
Oh, PT's so good. You're going to want more?
Yeah, no doubt about it.
Where's it at?
Yeah. We're in Corvallis, Oregon, the corner of 9th and Walnut.
Okay.
Across from the Green store.
Yes. Get your weed and then get the exercise you need at Encore Physical Therapy.
Weed first.
Yeah.
Then rehab.
Oh, my gosh. Now, I'm going to say that there's one more thing to remember, and it's not about the hospital, right? There is no S in hospital, but there's also no I in pitch.
Ah.